Welcome back, everybody, coast to coast, This Week in America, website thisweekinamerica.us. With us on the program, Dr. Bobbi Kline. She's a physician, author, teacher, and entrepreneur who is dedicated to transforming healthcare through creating individualized health unique to each person's DNA. She has experienced the power of using DNA to create personalized health firsthand for herself, her family, and her patients. Board-certified Ob-Gyn, functional genomics expert, Dr. Kline has created and taught programs in integrative and functional medicine, genomics, epigenetics to healthcare professionals, students, and the general public. She deeply believes in community and collaboration. They're needed for this revolution and is passionate about sharing the message that you can change your genetic destiny. Dr. Jo Veltmann, she has co-founded Genomic Solutions NOW and NCG Health Solutions to bring this new approach to healthcare practitioners and their patients around the world. Dr. Kline, welcome to This Week in America. Great to have you with us on the program.
Thanks, Rick. It's great to be here.
That is a new word for most of us out there, and that's genomics, and we'll talk about that in just a second. But your background is fascinating. As I mentioned, for over 20 years, experience in women's health medicine, board-certified Ob-Gyn. But what you really felt there was something missing. You wanted to be a little more proactive in your treatment. Talk about how you got to that point and how you found out about something that really has made a major difference in you, your family, and your patients.
Sure. I loved what I did in my profession in Ob-Gyn, having relationships with women and really helping them really navigate a lot of different aspects of their health throughout their lives. What I found is that I started being unable to answer questions as to why. Why were some things happening? Why did some things work and some things not work? And I started to dig, and I realized that my traditional training did not give me the tools I needed to find these answers.
You were searching, basically you were looking for what the root cause of health and disease, finding out what the problem is, and you came across genomics. Talk about that, and then you were overwhelmed with information, and that's how you ended up collaborating with Dr. Veltmann.
Yes. I started studying all forms of alternative medicine, some energy medicine, got into functional medicine, which is really looking at, on the biochemical level, what's at the root cause of health and disease. And then I kept saying, well, what's further? What's further? And how do I distinguish as to what's going on with one person versus another? And that's when I started getting into genomics and understanding that, wow, when we understand what's going on at the gene level, that's a game changer. And when I started looking into this, the research was absolutely overwhelming. I was not a trained researcher, and trying to wade through all this was very time-consuming and difficult to learn how do I translate this into my patients. And so I searched around the world, actually, and found Dr. Veltmann in New Mexico. And he had been using genomics at that time for over 10 years in a clinical practice. And so for me, when I want to learn something new, I jump in feet first and I just immerse myself. I did my own testing. I tested my kids. I started using it with my patients and learning from Dr. Veltmann. And it just completely transformed how I look at health and wellness.
Dr. Roberta Kline, our guest on This Week in America. The website is gsnuniversity.com, gsnuniversity.com. Go to our website, thisweekinamerica.us, and you can link on directly and get information on Dr. Kline and get everything we're talking about today, and you can actually get in contact with her by doing it that way. Once you started using genomics, talk about the changes, because you said you were really blown away by the changes, the positive changes that you were seeing in your patients.
Yeah, it was amazing. When somebody would come to me before I started using genomics, I could get a fairly, detailed level of what was going on biochemically through lab work and assessments, but it was still kind of a guessing game. I didn't really know exactly what each person needed. And when I started using genomics, it really was a game changer. I'll give you an example. I had a woman in her early 30s who came to me with a complaint that's very common. She was having trouble losing weight. She had struggled with weight issues since her teens, and she had tried various diets and sometimes would lose weight, but it was never sustaining. And actually, at this point, She had been diagnosed with diabetes and was on metformin and was reducing her caloric intake. So she was on yet another diet. She was exercising 6 to 7 days a week for an hour and a half at the gym, and she was gaining weight. And she threw her hands up. She said, I don't know what to do. And without genomics, I would have played a guessing game. But when we got her genomic testing done, we could really look and see what was going on underneath. And what we found were several things. One is she is highly predisposed to being overweight. And so for her, it's a much bigger struggle than for somebody who's not. And also stress was playing a huge role in that. And then her exercise was actually increasing inflammation and actually causing her to gain weight. And that's something that's not intuitive. You think you exercise more, you lose more weight. But for her, it was actually making the problem worse. And we wouldn't have known that without looking at her genomics.
What is genomics? We hear genetics, and for most people, it's like, okay, I have an understanding. Now we're introducing a new term to many people. Talk about the basis of that, and then we'll talk about how you go about the testing. After the testing, there's interpretation, and there really are actionable results that you can take from there. But what exactly are we talking about with genomics?
Sure. So the actual definition of genomics is actually looking at all of the DNA in an organism. So when we talk about us, it's looking at all of our DNA. It includes genetics, genomics, epigenetics, everything that has to do with the DNA in your entire organism. What I mostly focus on is what we call nutritional genomics, or another word commonly used is nutrigenomics. So it's how your genes impact the kinds of foods that you need to eat, and also how what you eat and your lifestyle actually impact how your genes function. And genes are really important because they provide the blueprint, the code, if you will, for all of the proteins in your body. So any enzymes, skeletal muscle, your immune system functions. So it controls everything that goes on in your body.
And you say that most chronic illnesses are the result of interactions between your genes and your environment. So once we know that, are we able to maybe prevent some of these chronic illnesses?
Yeah, and that to me is the most powerful thing, is that this is not just, it's a genetic mutation, there's nothing you can do, and you got to live with it. There are actually things that we know what to do in terms of diet or supplements or lifestyle that can either mitigate the potential impact of that, lessen the impact, or even actually just totally go around it and potentially prevent a disease that you might otherwise be predisposed to.
Dr. Roberta Kline, our guest on This Week in America. Her website is gsnuniversity.com, gsnuniversity.com. We're talking about genomics. She also is with Genomic Solutions Now, which we'll talk about in just a second or so on the program. Let's go back and talk about the testing. How difficult is this? Is this something that takes a lot of time? Is it painful? Is it something that, are there any negatives related to it?
Well, actually now the technology has improved, so we can just use a cheek swab. So it's very easy. It's non-invasive. You can do it at home, and then everything gets done from there. The cheek swab actually collects cells from the inside of your cheek, and then from those cells we can see what's going on in the DNA.
And then, as I say, you interpret, and then you can take some actions. Let's talk a little bit about some of the actions that you can take. If someone comes back in the case where there is this weight loss situation that you were talking about, so you can specify, individualize, like a treatment or a regimen that they should be on to try to eliminate that problem.
Right. We all know there's some popular diets out there. There's paleo diet, there's vegetarian, all sorts of different ways for eating. And some work really well for some people, but not for others. And part of that is in their genes. So when you look at the genes, you can tell if somebody's really sensitive to carbohydrates, for example, and they really need to eat very minimal carbohydrates in their diet. Somebody else might be very sensitive to fats. And so you can really tailor what they eat on a macronutrient level in terms of fats, proteins, and carbohydrates. You can also look at specific nutrients. A key example is, say, vitamin A. Most people know that you get your vitamin A from beta carotene. That's in yellow and orange fruits and vegetables. But that beta carotene has to be converted into the active form of vitamin A. And if you have a typo or a SNP on that gene that controls that process, you actually don't necessarily benefit from the beta carotene. And so you may be thinking you're getting your vitamin A through your diet, but you actually aren't, and you can be deficient in your vitamin A.
You mentioned a SNP. Talk about exactly what that is and then how you're able to basically work around that.
Yeah, so our DNA is made up of 4 different letters, building blocks, if you will. And a SNP is what we call a single nucleotide polymorphism. That's a fancy name. And it's just a substitution of one of those building blocks. And just that small little error can create a change in the protein that's produced by that gene. So it changes the instructions a little bit. And that could potentially, sometimes it has no consequence. Sometimes it can cause that gene, that enzyme or protein that's produced to not function as well, or sometimes it actually functions too well. So it can have multiple different effects. Then that affects how your biochemistry and how your body systems run.
What impact does this have on you and others in the medical community? Because it sounds like instead of guessing, as you said, you had to have done the old way when you're dealing with someone who has this weight loss problem and you can't quite figure it out because she shouldn't be having this problem. What's it like when you're able to really get to the bottom and eliminate a lot of that guesswork and really help your patients?
It's magic. It is so powerful. It's powerful for the patients because they can see, wow, I am different, and now I know how I'm different, and that is just so empowering. It's to me every time, no matter how long I do this, it's just amazing to watch this. And then as a practitioner, it really helps me hone in on where do I need to focus for that patient, where are the priorities, and so rather than helter skelter, throwing things against the wall, see what sticks, I can actually really guide them in a much more specific way. So it saves time, it saves money, and it saves health, so it's just amazing.
We're talking about genomics, Genomic Solutions Now, one of the companies we're talking about on the program today with our guest, Dr. Roberta Kline. I want to talk about, in an ebook that you have available, Change Your Genetic Destiny. You have a lady there, Alicia, and this really sort of emphasizes the point you're talking about. She right now is like 65, loving life, doing quite well. Not that many years ago, she was worried about the history of breast cancer in her family, and she was just sort of waiting for it to happen. Talk about her case, the testing that you've done, and where she is now.
Sure. Alicia is just one of many women who are either at risk for breast cancer, or what many women don't understand is, Alicia had a family history, but a lot of women and most women who get breast cancer don't have a family history. So what we did is we looked at the genes that code for the enzymes that control how you break down the estrogen in your body. So estrogen, when it, like any other compound, has to be broken down in order to be eliminated from the body. And that's controlled by a bunch of different enzymes. And if those processes don't work well, you can actually end up with compounds, chemical compounds in your body that create DNA damage and can really increase the risk of breast cancer. So when we looked at her genes and her gene SNPs in these pathways, and then we used some urinary testing to see how compromised those pathways were that we knew were predisposed in her gene SNPs, we were able to use all that information to customize a lifestyle regimen, diet, and some specific nutritional supplements to change the functioning of those pathways and make her estrogen metabolism much more efficient. And so the beautiful thing about this is that not only can we know what changes to make and make those changes, we could follow her. We in urine follow how well were these interventions working, and if there were times at times in her life when she was under more stress, that can actually impact the estrogen metabolism. We were able to see that and keep adjusting. So she could know fairly quickly how things were working and not just say, well, I hope it's working and let me just see if I get breast cancer. So it was fabulous.
And really turned her life around, literally, didn't it?
Yeah, because she lived with this weight over her head that, oh my gosh, this, the people in my family, they get breast cancer. We don't have a genetic mutation. People know about the BRCA1, but it is probably going to happen to me, and I just don't know when, and I don't know what I can do about it. And it completely changed her whole perspective. Now she knew why she was a potential risk, and she was able to change that and monitor the effectiveness of that throughout her life. So now she's not worried about it. She knows as long as that she keeps doing the things she needs to do and we keep monitoring how that's working, her risk is minimal. And it's really changed.
Once we do the testing, is that something that needs to be done periodically or one time and you have the answers?
So with the genomic testing, once you have that done, that's it. The only reason to do a genomic test again is if because the information is just exploding, we're discovering new gene SNPs and how they work and how we can use them. That would be the only reason to to do new testing.
It's interesting you said everything is exploding. Did this come out of the Human Genome Project, which was early 2000s in that time zone?
It did. Actually, the Human Genome Project was proposed back in the late 80s, early 90s, and it took a while to get it going. And the goal was to sequence the whole human genome. And that was finished in 2003. And that has absolutely spawned a whole new way of looking at health and disease and wellness and how the body works.
A few minutes left in the program. Our guest on the show is Dr. Roberta Kline. We're talking about genomics, and information is available at our website, which is gsnuniversity.com. Go to our website, thisweekinamerica.us, and link on directly to the doctor's website. In talking about that, you've become like a major advocate, traveling around the country, talking to organizations, lecturing. Actually, what co-created a curriculum being used in medical school. How are we doing at getting this word out to younger medical professionals, which I assume is where we're going to see some dramatic changes in the whole healthcare system?
Yeah, it's slow. It's just the world of traditional medicine is very slow to take on new ideas. So we're working on multiple different levels to try and get the word out and help people. It requires a whole different way of thinking. And so it's a slow process, and that's one of the reasons why we've created educational companies and why we, are really passionate about helping clinicians learn. It's a steep learning curve, but just one step at a time. What we're finding is nutrition professionals are the ones that are most receptive right now because they work with nutrition. They know the power of food. They know the power of lifestyle. And so they don't have to be convinced that actually works. And so that's right now the audience that has been most receptive. So it's a slow process.
What happens like that when you talk to someone, they go, it really makes sense. There's a science base for this. It makes sense. I'm going to try it. And they try it. And like you, they find remarkable results. What's that like when the light bulb goes on for them and it's like, wow, I can actually help my patients now. I can make them healthy again.
What the feedback that we are getting is that health professionals, whether it's nutritional professionals or physicians, they're excited about what they're doing again. It's a renewed vigor. It's something new, and they feel like, oh my gosh, now I have a new tool. Now I can really, really make a difference.
Dr. Kline's website is very simple, gsnuniversity.com. All the information you will need there. And we'll have Dr. Kline back because there's so much more to talk about this. We're talking about the role of genomics, and Genomic Solutions NOW is one of the companies you'll see when you go to that website. Dr. Kline, this is really exciting, and I can tell how excited you are because you're actually seeing results, not only your patients, but your family, and I'm assuming yourself as well?
Oh, absolutely. Yes. It's totally changed my life. That's how I got into a lot of this, not only answering questions from a patient, but finding answers for my own health concerns that I couldn't find in my traditional training. So, yeah.
GSN University is the website. Dr. Roberta Kline, our guest on the program. Doctor, thank you once again for being with us. We will have you back and looking forward to it on the program. Thank you for sharing some great information with us.
Thanks, Rick. It's been great to be here, and I look forward to coming back.
Again, the information available at GSN University. And of course, you can get all the information by going to our website, thisweekinamerica.us. Stay tuned. We're right back after these important messages.